SPANK block. SPANK stands for Selective Sensory Posterior Articular Nerves of the Knee. In this block, a linear ultrasound probe is kept sagittally over the junction of the femoral shaft and with the femoral epicondyle, to visualize the adductor tubercle on the medial aspect of the distal thigh. And a 15 ml of drug local anesthetic is deposited after hitting the bone over the adductor tubercle, avoiding the popliteal vessel in the needle trajectory. In their dye study, they found involvement of the medial side of genicular nerves along with the popliteal plexuses. So if you see, the probe position is exactly like that of adductor canal, distal adductor canal or IPAC block. Even the sonanatomy picture will be the same, popliteal artery and condyle of the femur. In IPAC block, the drug is getting deposited in the gap between popliteal artery and condyle of the femur, whereas in adductor canal drug is getting deposited below the sartorius, and in SPANK block drug is getting deposited over the bone, that is medial femoral condyle. But the coverage of the innervation will remain the same. It will involve the popliteal plexus because the branches of the popliteal plexus lie into this particular area. This is one of the comparative study comparing combination of adductor canal block and IPAC with combination of adductor canal block and SPANK. They concluded that the analgesic efficacy of the combination of adductor canal and IPAC is better than the combination of adductor canal and SPANK. If you read about the technique of adductor canal, it appears that the injection was given below the sartorius and apex of the femoral triangle is not identified. So it can be a distal femoral triangle block, not the adductor canal block. Also, if you read, they have used straight leg raise test to measure the quadriceps strength. SLR mainly tests the hip flexor, not the knee extensor. If you want to check the quadriceps strength, knee extension is the better parameter. So techniques and measuring parameter in such study always make a big question mark about its scientific design.